Thank you very much, Mr. Speaker. Mr. Speaker, I want to thank you and honorable members. I want to thank the Holy Spirit for this opportunity once again to address this honorable House, to spend time with honorable members to discuss the business of the country. Mr. Speaker, before I begin my presentation, I wish to ask you to allow me to recognize a group of young people who have come from the constituency of Vieux-Fort North to observe the proceedings today and to tell them welcome. I also wish to wish all young people in St. Lucia a happy Youth Month. As you know, Mr. Speaker, April is Youth Month, and I wish all young people in this country a healthy and happy journey through their youth, and tell them to continue to contribute to the country of their birth. Mr. Speaker, once again, we see the machinations of the leader of the opposition. We know, Mr. Speaker, that tradition dictates that the leader of the opposition responds to the Prime Minister immediately after the budget address. This has happened every year, Mr. Speaker, when we were in opposition. And we see once again the leader of the opposition playing games with this parliament, appearing and disappearing, and standing up when he really should not be standing up, just to show people that he is in the House and he has disappeared once again, Mr. Speaker. It just shows the kind of person, the kind of leader the leader of the opposition is. Having said so, Mr. Speaker, I really want to thank the Holy Spirit, from whom I get sustenance. I love and appreciate my family, Mr. Speaker, for the sacrifices that they make to allow me to serve our people. Thanks to my team at the constituency office, my political team on the ground in Vieux-Fort North who assist me, to my constituents who serve in organizations to benefit our people, I recognize your efforts. Speaker, I'm a very fortunate person. So many people love and pray for me. I thank them all. Thank you, Mr. Speaker. Our people continue to believe strongly that the policies of our government will continue to bring development and relief to our steadfast and committed constituency, Mr. Speaker. The constituency of Vieux-Fort North, which has stood firmly in the belief that the St. Lucia Labour Party will deliver to them and to the people of St. Lucia. I wish, Mr. Speaker, to also thank the Permanent Secretary, Ms. Daniel, and her staff, all of the staff of the Ministry of Health, Wellness, and Elderly Affairs, all the departments, everyone who works at the hospitals, at the health centers. I want to thank everybody, Mr. Speaker, for all of the work that they've done throughout the years to help secure the health and well-being of our people. And I want to thank them because of the work that they've done with me and this government during my tenure. As we continue to work to develop the health sector, Mr. Speaker, I want to tell them I really, really appreciate all of the help and support that they give to me, especially to my driver, Mr. Keenan, also my secretary, Ms. Rambali, my secretary, who is my Ms. Florius, who is unwell, and Ms. Rambali, who is holding on. I thank you both for your dedication and your work. To say that I support the proposals in this year's appropriation bill, Mr. Speaker, would be an understatement of enormous proportions. Mr. Speaker, the Member of Parliament for Castries East, Minister for Finance, and Prime Minister, I must say, deserves commendation, Mr. Speaker. As I said in the estimates debate, the constituents of Castries East must be proud. The Prime Minister's family must be proud. And I am sure the positive energy of his deceased mother, father, and siblings must be within his aura now, encouraging and inspiring him, Mr. Speaker. This Prime Minister, Mr. Speaker, has worked. They say work smart, but this Prime Minister has worked both smart and hard, Mr. Speaker. He has kept his promise. He has kept his promise to put St. Lucians first in every way. My colleagues have all agreed, Mr. Speaker. We will bring the message of hope and progress to every adult, every youth, every St. Lucian, so that together St. Lucians will return this Prime Minister to lead this country whenever elections are called, Mr. Speaker. I want, Mr. Speaker, I want you to lay your head with me on the rumbling hard floors of 2021. This Prime Minister, as our leader leading into the elections, promised our people to increase attention to health care, to accelerate work to provide greater access to good quality health care, to implement universal health coverage, to incentivize the private sector to provide health care services, to complete the St. Jude Hospital, to put more resources in the Millennium Heights Medical Complex, the OKEU, and the St. Jude Hospital, to fund and promote healthy lifestyles, among many other promises. And these were the days of the turbulent times of 2021, 2020, 2021, Mr. Speaker, when the last government was in office. In an environment where the health system was already struggling, Mr. Speaker, it was further compromised by COVID-19. And this Prime Minister took action. He took action to increase the health budget from $183.1 million in 2020-2021 to $206,073,800 in the 2025-2026 budget, the largest ever in the history of St. Lucia, Mr. Speaker. This Prime Minister increased the Millennium Heights Medical Complex budget. Most people refer to it as the Owen King EU Hospital. This Prime Minister increased the Millennium Heights Medical Complex budget from $31,647,939 in 2020-2021 to $70,561,888 in 2025-2026, increasing every year since 2021. This Prime Minister increased the subvention to the St. Jude Hospital from $17 million in 2019 to approximately $24 million in 2025-2026, Mr. Speaker. This Prime Minister increased both clinical and support staff throughout the health system, completed major repairs to health facilities, completely refurbished or are in the process of refurbishing many more, increased allocations of funds for pharmaceuticals, provided resources for the accident and emergency departments at our hospitals. These are just a few of the things that this Prime Minister has done in the health sector. We continue, Mr. Speaker, to take concrete actions to improve the healthcare delivery systems in St. Lucia with the unwavering support of our Prime Minister and Minister for Finance. Cabinet, and with the work of our professionals in team health, we continue to address the gaps that exist in our mission to provide all with accessible, affordable, world-class health care. We are doing a number of things, Mr. Speaker, and we are working with teams from PAHO, from other agencies, from all of our partners, from workers within the ministry and the professionals to continue to refine our vision, our mission as we move forward. But what are we working on? We are working to build a healthy and resilient population with the collaboration of all health partners, Mr. Speaker. We want to foster a robust, integrated, and sustainable health system that provides comprehensive, quality services at all levels, ensuring health equity, resilience to the future health threats, and access to affordable care and financial protection. We want to achieve equitable access to quality health care for all, especially the underserved and vulnerable populations. We want to enhance health system resilience and sustainability. We want to ensure health services that include addressing social and other determinants of health. We want to foster transparent, accountable, and inclusive decision-making at all levels. We want to ensure, Mr. Speaker, that we improve healthcare coverage and equity, strengthen human resources for health, enhance sustainable health financing, improve healthcare quality and infrastructure, strengthen public programs, integrate health systems for better health service delivery, promote health equity and address social determinants, as I said before, strengthen mental health services, and improve and increase public-private partnerships. Let me tell you, Mr. Speaker, what we are working on and what all of us and the people of St. Lucia should expect, Mr. Speaker, what we are experiencing and what we should expect. We are experiencing, as we know, increasing health costs. We know our population is aging. We know that 37% of the health costs is out of pocket, meaning people have to use their own monies directly out of the pocket to pay for medicines and so on, 37%. And although, based on our analysis, we believe there is enough funding within the entire health system, what is the problem is it's fragmented, Mr. Speaker. The health financing system is fragmented, and who suffers the most? The vulnerable. What we have done, Mr. Speaker, is to work with the World Bank, work with JIPA, the JIPA network, a consultancy firm, and a lot of work has been done over the last few years to consolidate our ideas on healthcare financing. We are not doing like the last government, and they are in opposition now, going all over the place telling people they are going to give them X amount of health insurance without explaining anything to anybody. What we have done, Mr. Speaker, is to present a model to a wide cross-section of the society. We have received input from them, and we are working on it, and I will tell you what we are going to do, Mr. Speaker, what we have been doing. We are going to use a consolidated model or stratified pool risk model, Mr. Speaker. What this means is that funds from various areas will be consolidated or put together, deposited into a UHC special fund where the risk is spread across different funding tiers. The goal is to improve the nation's health profile, reduce healthcare costs, and promote sustainable development. This aligns with the National Strategy for Healthcare, following the World Bank, World Health Organization, and Sustainable Development Goals and targets. To achieve this transformation, Mr. Speaker, the universal health coverage will be financed through a public-private partnership. It will not be fully funded by the government, or it will not be a fully nationalized system. You hear on the other side, again, all they're bandying about is that they had health insurance to give every single St. Lucian. We have not heard the explanation, Mr. Speaker, so I cannot compare what we are doing with what they think they said they would have, could have, should have, and will try to would have done. It's a lot of bluff, Mr. Speaker, a lot of bluff. So we are explaining to you what we have explained to the people of St. Lucia. We will emphasize information and data sharing across public and private sector providers. So right now, the private sector is working in silos, in its own system, the private doctors and the pharmacies and so on. The public sector is working in its own silo, and there is no cross-fertilization. They are not working together. What we want to do is to have an integrated system which is based on information. The proposed benefit plan will be structured into 3 tiers, Mr. Speaker. The first one will be government funded, providing essential healthcare services to most of the population with a focus on primary and secondary care, the essential package of health services. So, for example, cancer screening, dental services, eye care services, mental health services, nephrology, meaning kidney care services, and so on, breast cancer and that kind of thing. The second tier will involve a mix of private insurance employer contributions, government support, catering to individuals and families who can afford additional coverage. So there's a certain level that the government will cover. There's another level that if you want additional coverage, you can also participate in. And the third tier provides for complex and catastrophic healthcare needs, including overseas care when necessary. This will be supported by reinsurance mechanisms. It's important to understand, Mr. Speaker, that this stratified pool risk coverage model, it consolidates public and private healthcare financing into one system. There will be a universal health coverage authority, and the key features of that, Mr. Speaker, will be the elimination of upfront payments and the reduction of out-of-pocket spending. Remember, 37% of our healthcare costs comes out of pocket. You have to pay for it out of your pocket. We are going to establish a framework that ensures that even tourists can contribute to the healthcare funding. It must be supported by an integrated digital system and, of course, comprehensive legislation. As I said before, we are going to establish the Universal Healthcare Authority. And we are discussing with the NIC and other organizations whether it should be an independent authority, housing the National Insurance Corporation, or embedded in the NIC and phased off for a while. These are being discussed. Each of these options have their own trade-offs and benefits. In other words, Mr. Speaker, we are creating a framework, and we are not thinking about creating it, we are actively creating a framework which will allow us to fund and finance sustainably the Universal Healthcare Program. Additionally, Mr. Speaker, a Friends of the UHC Fund will be established, and it will be for individuals who want to contribute, philanthropic organizations and individuals who want to contribute. In fact, a few years ago, in Cabinet, we actually approved a Universal Health Coverage Fund to be established under the Consolidated Fund. Technology is important. Today, Mr. Speaker, if you have to look at the landscape information, the information system landscape in St. Lucia, in the healthcare system, it cannot operate by working with each other. It's interoperable. In other words, as I said in the last debate, if a patient goes to the health center, and then this same patient goes to the St. Jude Hospital, and then this patient is transferred to the OKEU Hospital, at every stage, they have to record them. If you gave them medication at the health center, you have your records there with SLUIS, but if you go to another stage in the healthcare system, your record does not follow you easily so that the medical professionals can take care of you. We are going to ensure that we have a system that is interoperable, open source, standards compliant, digital platform, which will be able to process bills, have fraud detection, data analysis, and integrated across all sectors. You cannot have a healthcare system, you cannot speak about a healthcare system if you do not have interoperability across systems, private and public, at the pharmacies, the private doctors, and so on. All of this, of course, supported by very strong legislation. So I'm giving you, Mr. Speaker, honorable members, and the people of St. Lucia, where we are at, a clear idea of where we are going. We are not confusing you by just telling you, oh, we have insurance for you. This is a clear idea, this is the roadmap, this is where we are going, Mr. Speaker. Legislative reform is very important because we have to look at data protection, and while some of this is already existing in our legislation, privacy and so on, we have to deal with that. It's important, Mr. Speaker, that everybody comes on board. And we are not just guessing everybody will be on board. We have had consultations with the various ministries, Ministry of Health, Ministry of Finance, Ministry of Equity, Attorney General, National Security Team, including police, fire, prisons, tourism authority, Invest St. Lucia, education sector, healthcare, the St. Lucia Medical and Dental Association, St. Jude, Millennium Heights, Tapio, Nurses Association, Financial Services Regulatory Authority, NIC, National Insurance Corporation, credit unions, financial institutions, the Bar Association, the St. Lucia Chamber of Commerce, the business sector and youth economy, telecoms and digital companies, to look at digital payments, community-based organizations, churches, associations, even the diaspora, community chairpersons with various sensitization activities. So this has been across the board. We have gone to churches, the pastors and priests and so on are inviting the ministry to come and speak to them about universal health coverage financing. So we have involved, and the consultations continue. There are many other groups that have not been consulted, and they will be consulted. Mr. Speaker, what have we done? We have continued with the World Bank project, which is the PBF, performance-based financing, and this World Bank project has taught us many lessons which will be fed into the financing of universal health coverage. I want to thank the team at the World Bank, thank Edith Villeneuve and her team. Also, I want to thank the local team, the PIU, Mrs. Jeanette Hughes, Mr. Baptiste, and many others who are working on that. And we are trying to increase patient demand for screening and treatment of diabetes, hypertension, and other services. We have to ensure in the PBF that high-quality services are delivered. And third, Mr. Speaker, we are experimenting with an output, performance-driven product, where you give incentives for performance, which is what eventually the universal health coverage financing will do. So doctors who will enroll in the universal health coverage financing model will be incentivized based on the number of patients they see, the quality, and so on. Because we realize in our system, Mr. Speaker, incentives play a big role in the delivery of quality health care. And the lessons learned from the PBF are teaching us some of the gaps that we have to fill as we move to the financing of universal health coverage. Together, Mr. Speaker, we want to move toward greater accountability, improved quality, and measurable results for the people of St. Lucia. Let me just tell you a little about some of the actions that have been taking place. At the launch of the PBF, the number of registered hypertension cases in the system stood at 1,143 in July 2023. By March of 2025, this number had increased to 1,948. Similarly, registered diabetes cases rose from 849 to 1,096 over the same period. You can speak to Ms. Bissette, the health aide at Lafargue, and also Flora, the health aide at Delsay, and she, not the health aide, but the health center attendant, and they will give you an idea of how the people are getting the services and coming to receive even more services. The PBF project ensures that screening and treatment for hypertension and diabetes are carried out in alignment with the national guidelines and clinical protocols at the wellness centers. Think about it. In July of 2023, just 3,964 patients were being screened for hypertension using the protocols. By March of 2025, that number more than doubled to 8,570. For diabetes, the numbers grew even more significantly, from just 96 patients screened using the protocols, not just patients screened using the established protocols in July. And by March of 2025, in July of 2023, 96. By March of 2025, we had moved to 5,697 patients. And this data tells a story. It is not just that we're getting more cases, but more individuals are coming out, and we are picking up cases that require further attention. Again, I want to thank Ms. Edith Villeneuve from the World Bank and her whole team, and the team here at the Ministry of Health, Wellness, and Elderly Affairs. But not only that, Mr. Speaker, as we are moving forward with universal health coverage, here is what we are doing. We continue to increase support to our facilities, focusing on quality and quality service. We purchased 2 mammography machines, Mr. Speaker. And for the first time in the history of St. Lucia, you have 2 mammography machines in the primary care setting. One at the St. Jude Hospital and one at the Millennium Heights Medical Complex. We spent $463,000 through the Health System Strengthening Project, Mr. Speaker. And you know what that will do? The training is ongoing. It will advance our detection and the diagnostics for breast cancer in St. Lucia, Mr. Speaker. As you know, breast cancer is the #1 killer among women. If you look at cancers and so on, breast cancer is very, very important. And so the mammography machines will assist. We purchased lasers, surgical microscopes, support to the polyclinic, biomedical equipment, nutrition equipment, dental equipment and consumables for the Millennium Heights Medical Complex. We continue, Mr. Speaker, through the Health System Strengthening Project to improve the wellness centers. And Prime Minister said it in his speech, the Deriso Wellness Center was rehabilitated this year, Mr. Speaker. It is anticipated that works will begin at Babuno, Richford, Monrepo, and the Lafargue Wellness Centers, as well as the Dennery Hospital, Mr. Speaker. And all of these works should begin before June. In some cases, contracts have been signed. I'm sure if you speak to Nursing Supervisor for Region 2, Ms. Alexander, and her team, they will be elated to know that improvements are happening in the area. In the OECS Regional Health Project, we continue to smart the wellness centers, and the Delse Wellness Center is almost complete. I visited the Delse Wellness Center just a few days ago, and the work is almost complete. The member for Choiseul, I am sure, will be happy about that. The Canries Wellness Center, a contract has been signed, and we are still working with the residents in terms of the relocation while we fix the wellness center. The Grace Wellness Center in Vieux-Fort North, Fonasson in Babuno, Vanna in Ancillary Canneries. These centers are expected to be rehabilitated. The Grand Rivière, Laguerre, and Fossé-Jacques Wellness Centers, the bids have been received, and the evaluation process is scheduled very soon. All of these are World Bank projects, Mr. Speaker, and various contractors from all around the country are applying for these works. Jacmel, Etangs, and Tirochet Milku Wellness Centers are also down for refurbishment. Mr. Speaker, I am just excited to explain to you why I am so connected to what the member for Miku North said, that we are not like them. We are very different. Even when we found programs from the World Bank and the OECS regional program, you can see the acceleration of the implementation of these programs under the Member of Parliament for Castries East, Mr. Speaker. We continue to enhance facilities. The Betty Wells Urban Polyclinic. The government of St. Lucia took a bold step and a decisive step, Mr. Speaker, to open the Dr. Betty Wells Urban Polyclinic last year during the first week of December 2024. It's important to note that even though the Dr. Betty Wells Polyclinic does not yet have the full range of primary healthcare services, it is providing a critical service which is assisting the Owen King EU Hospital, especially for non-emergency cases. Between January and March, the polyclinic recorded an average monthly utilization of 3,100 patients. 3,100 patients per month. From December 2024 to April 2025, a total of 12,381 individuals accessed services at the Dr. Betty Wells Polyclinic. Dr. Werner and the rest of the team, Nurse Simon McFoy Solomon, you can speak to them, and while they have challenges, still, because it's a work in progress, when you hear the opposition talk about Ki Betty Welsa and all the nonsense that they spew, here are the figures. Go and tell these 12,381 people that they should not receive service at the Dr. Betty Wells. Go and tell them that. And just December to April, 12,000 people received care. And just a few weeks ago, we introduced radiology services at the Dr. Betty Wells Urban Polyclinic. So the Urban Polyclinic opens until midnight, and it also opens during the weekend. You go and tell the people that this is not important. You can see they are not like us. They do not have the welfare of the people of St. Lucia. They do not have that as their main priority, Mr. Speaker. They're just breaking down and breaking down. Mr. Speaker, it underscores the polyclinic's strategic support to the Owen King EU Hospital. It manages non-emergency cases and reduces congestion at the island's main referral facility. Although we still have congestion, just imagine if we did not have the Dr. Betty Wells Polyclinic, it would have been much worse, Mr. Speaker. Plans are underway for the rehabilitation of the accident and emergency building and the Francis D'Alto building at the Dr. Winston Paris Medical Complex. which will further enhance the polyclinic services. The building has been gutted, and architectural drawings have been finalized to move on with construction. I want to say hello to Nurse Alexander, Nurse Lauren Eugene, Nurse Shalama Alphonse, Sulphur City, Mr. Speaker. And the Soufriere Hospital, some of the services, some of the new facilities with the help of Sugar Beach, and we really want to thank Sugar Beach for their contribution to this effort, the management and staff of Sugar Beach. The Soufriere Hospital has seen major improvements, Mr. Speaker, during our term. And when I listen to the opposition speak about Soufriere Hospital and so on, Mr. Speaker, I don't have all the time today. I can spend a whole 2 hours just on improvements at the Soufriere Hospital. But I'll give you a few. If we have to look at the conditions prior to the recent upgrades, Mr. Speaker, you can see we had severe structural damage from past natural disasters, a compromised roofing, frequent power outages due to unreliable electrical infrastructure, outdated medical equipment, inadequate water supply, poor drainage, limited inpatient capacity, shortage of trained personnel affecting the range of services available. And what did we do, Mr. Speaker? The structural upgrades, full replacement of the roof and ceiling, refurbishment of patient wards, electrical and water systems, installation of a new generator, upgrade of internal wiring, improvement of lighting, establishment of reliable water storage, medical equipment, procurement of modern diagnostic and treatment equipment, including hospital beds, monitors, oxygen supply systems, and laboratory devices, Mr. Speaker. Renovation of the emergency room, pharmacy, labs, maternity ward, and outpatient department. Improved workspace for the staff, and that was Sugar Beach, Mr. Speaker. So again, we want to thank them for their contribution to the works. Rest areas for the nurses, access to reliable IT and communication tools, better ventilation, more comfortable beds for patients, improve hygiene protocols. As a result, Mr. Speaker, at the Soufriere Hospital, patients have access to a wide range of services: pregnancy care, after birth, child, adolescent, women's health, and I can go on and on and on and on and on. Diagnostic equipment, Mr. Speaker, expanded lab services, hematology, chemistry, renal profile, liver profile, lipid, and you can go on, uric acid, HbA1c, Mr. Speaker, microbiology, serology, and so on, radiology and x-ray services. In other words, Mr. Speaker, Soufriere Hospital is now equipped with a full digital radiography system offering imaging across all anatomical regions, Mr. Speaker. We can do upper limbs, lower limbs, axial skeleton, chest and abdomen, craniofacial, sinuses, etc., etc., etc. Major improvements at Soufriere. So, Mr. Speaker, it is clear to see that actions have been taken to improve the services at our medical facilities, Mr. Speaker. There are still some ongoing challenges, but we are working with the team at Soufriere to ensure that these challenges are overcome. And once again, I want to thank Sugar Beach for their contribution, Mr. Speaker. We continue to expand, Mr. Speaker, and continue to improve the services, even while we work on the framework and structure of universal health coverage. And you can go and ask Nurse Jeannie Morgan, Nurse Raphael, Nurse Claudia's Daisy, the Grosile Polyclinic expansion, Mr. Speaker. We have spoken about it. We will go to 24 hours. The upgrades will include expansion and modernization of the accident and emergency units, new consultation rooms, increased capacity for medical consultations, a dedicated staff lounge to support the well-being and comfort of the healthcare professionals. And Mr. Speaker, we're not saying if we will do this, or we're not dreaming of it. If members opposite take a little drive right now, take a drive right now and go up to Grosile, they will notice that the facility is being constructed. Mr. Speaker, we continue with other areas. And ask the District Medical Officer, Dr. Ajuda, about the Lauritius Wellness Center. Nurse Leandra Anaville, Nurse Serrier. During the last financial year, the Prime Minister made a commitment. And not too long ago, we went there. It was a glorious afternoon. We went there and we opened the Dennery, the Larishus Wellness Center, Mr. Speaker. Upgraded facilities, maternal and child health, dental. And if you go there now, Mr. Speaker, I'm sure you'll want a health center like this in your community. In fact, the member for Dennery North calls it his mini hospital. And not only that, Mr. Speaker, as we continue to build and reform, despite all of what they say, Mr. Speaker, we continue to expand universal health coverage services. And in Region 8B, you can ask Nurse Bernadette Felix, the nursing supervisor, when we launched our maternal health services in June of 2023. In June of 2023, up to March 2025, approximately 2,490 new pregnant women access our services. Of these, 1,156 women were enrolled in antenatal care during their first trimester, enabling earlier detection of risks and better outcomes. We also conducted 3,555 ultrasounds, provided lab testing to 2,490 pregnant women. Notably, listen well, Mr. Speaker, 1,220 high-risk pregnancies were identified and managed, demonstrating, Mr. Speaker, the system's growing ability to screen and support vulnerable mothers through the universal health coverage. Who knows, Mr. Speaker, what could have happened if they did not have access to these lab tests and ultrasounds. And in Region 7, Nurse Yasmin Gabriel, Mr. Speaker, and all of these nurses and doctors have participated in the response to the challenges in healthcare. The cancers, Mr. Speaker, we recognize the growing burden of cancers, and we responded actively, Mr. Speaker, in the area of cervical cancer. From August 2024 to March 2025, over 3,000 women were screened, and 1,822 HPV tests were performed. Among these, listen well, 299 high-risk HPV samples were detected, representing 16.4% of those tested. Each of these detections, Mr. Speaker, represents a life potentially saved through early intervention. We did not just stop there last year. On the men's health front, Mr. Speaker, during December 2024 to March of 2025, we launched targeted prostate cancer screenings, reaching 450 men, conducting 361 PSA tests, 184 digital rectal exams, and referring 95 men for ultrasounds. This effort represents a significant push to overcome stigma and to improve early detection of a disease, Mr. Speaker, that remains a silent killer among our men. I really want to thank again the healthcare professionals. There was a men's health clinic in the past, and the reports that we have, when we look at the figures, single-digit figures, you had to cajole the men, beg them to come. But with our new men's health clinic, we are providing the free PSA tests, free ultrasounds. Men are coming in their droves. And I want us, Mr. Speaker, to give the men of St. Lucia a round of applause, Mr. Speaker. So while they are telling people not to go to our doctors, the men are coming to the health centers to do their different tests. Power avec you, Mr. Speaker. You need l'argent pour payer un ticket à l'autre pays, bébé, vini à health center, attends. Vini pour un petit test, attends. Si porter qui laisse partir ouvrir. Mais là, il vient pour prostate test, I pour test tout. Pas mal avec you, Mr. Speaker. So, Mr. Speaker, in Region 6, nurses like Shirley Ann Lamontagne, Eloise, Mr. Speaker, and her team have been working very hard. Even snake bite management was launched, Mr. Speaker, and we have support for people in that regard. We established a biomedical unit, as I've said in the past, Mr. Speaker. And through that biomedical unit, we now have more than one we have a biomedical engineer and other trainees and other technicians who have a unit. They have a vehicle now, and they have a schedule of checks So if you go around the health centers, Mr. Speaker, even at the hospitals, you'll find that you have fewer complaints with your biomedical equipment. There were times when I became minister, we went around, we had biomedical equipment down for years, Mr. Speaker. And there was only one biomedical engineer for the whole island, Mr. Poleon. And I want to thank him for his service to this country. So now we have a whole unit. We have a whole unit, just like maintenance. We have established an entire maintenance unit with schedules, Mr. Speaker. So we are adding layers of responsibility to our healthcare system. And I don't have the time to tell you all of what we have done with biomedical, chemistry analyzer, defibrillators, AEDs all around, Mr. Speaker, ultrasound machines. I don't have the time. There's so many of them. Viewfort Wellness Center, Labrie Wellness Center, Ancillary Wellness Center, introduction of colposcopy clinics, and so on. And all around the country, Mr. Speaker, the biomedical unit has supplied equipment, and they are helping. A difference, Mr. Speaker. Mr. Speaker, and throughout all of this work, all of the work that the Minister of Finance is doing to buttress and to support healthcare in this country, he still has time, Mr. Speaker. That's why I tell you, he's better than them. Better than them, better than them. He still finds time, Mr. Speaker, for the constituency of Vieux-Fort North to design and develop the Rambo-Poleon Theatre and Performance Facility, Mr. Speaker. We are going to transform the Human Resource Center at Bellevue into a great Rambo-Poleon Theatre. And somewhere in there, Mr. Speaker, you will see the joy. It's not just going to be a pash, pia thing, you just nail something to thing. It's going to be a well-developed center, Mr. Speaker, and the people of Vieux-Fort North will be proud of it. The 10-year passport, our people of Vieux-Fort North will benefit from that. The feminine hygiene products for secondary schools. The payment of an additional 2 CXC subjects. I was happy when I saw that, Mr. Speaker, because in Vieux-Fort North for the past few years, if you wanted to write maths and English over, I would pay it for you. Now, the Prime Minister, although he said he's a foreign, and it seems I still have to pay, Mr. Speaker. So, we are continuing to encourage the people of Vieux-Fort North to do your subjects. Nurses, Mr. Speaker, for the first year, 2,500, second year, 2,500, third year, 5,500, and final year, $10,000, Mr. Speaker. Where is all the money the member for Miku South said he had? He was the great manager. He was the great CEO of the government. And you couldn't give the nurses a little $2,000 to help them? And you couldn't give the nurses 10,000, pas même 10,000, nous pas buy you 10,000, nous pas buy you 10,000. Mr. Speaker, these people do not care about St. Lucians. They will give millions.
Member for Suzel.
Mr. Speaker, I would like to set out a point of order. The member is misleading. I mean, I like his exuberance, Mr. Speaker, but we actually provided nurses with, it may have been a lot smaller than what has been done now, but we provided.
Well, that's the point. He gave a figure. He said you didn't give 2,000.
He said we didn't. He said we didn't give anything. He said that.
He said you probably pay 1,000.
Yeah.
So what did you give?
$1,000, Mr. Speaker.
Please proceed, member.
C'est combien de thousand nous buy? Nous buy 10,000. Combien nous buy? So, Mr. Speaker, you see, Mr. Speaker, they are challenging. So I want, Mr. Speaker, through you, I want all the nurses to hear that, you know. We are giving the final year nurses $10,000. The opposition is standing up to challenge and say, oh, we gave 2. Don't say whatever. So buy kaka, no ka buy real buy, man. Real buy, no ka buy. No ka buy say Nosla, real buy. Anyway, Mr. Speaker, all non-established government employees, daily paid or wage earners, will be given permanent employment. After 2 years, 1,900 workers will benefit. Temporary teachers will now receive full salaries. And from January 2025, income derived from pensions will be tax-free.
Member for Beaufort North, I can't give you 10,000 minutes. We have 15 left.
Just 15 more. Yeah. Okay. Thank you, Mr. Speaker. So, Mr. Speaker, all of these developments, the Prime Minister and Minister for Finance can get money to refurbish, to have a new Laurentius Wellness Center, open Betty Wells, look, OKEU is coming up, 5th Wing, build St. Jude Hospital, do all of that, Mr. Speaker, and still get money to help with CXC fees and all of that. And you are telling me these people are for St. Lucians? They are not for St. Lucians, Mr. Speaker. Let them bring their card and to show the quality of what they did for the ordinary and the business and all people of St. Lucia. Let them come. Mr. Speaker, not only did we work to ensure that the infrastructure, the various facilities in health were fixed and refurbished, but we also worked on the human resources for health, Mr. Speaker. I am very thankful for the Prime Minister's support to our nurses, and there are other things we need to do to help retain our nurses, Mr. Speaker. There is a retention policy. We have worked with the Ministry of Education. Assistance to the nurses at Sir Arthur is one of those measures, but there are several other measures which we will implement as we go along. Mr. Speaker, the number of community pediatricians has increased from 1 to 2. Additionally, the inclusion of internists and a nephrologist in community clinics has improved access to specialized care. The number of senior medical officers has doubled from 2 to 4, with one now overseeing clinical protocols and standards of care at urgent care centers and wellness centers. The district medical officers, the number has risen from 21 to 29, expanding the ability of primary medical services across the island. The ministry has employed 20 health aides to provide support within communities. In May 2024, midwives across the country received specialized training to better manage complicated deliverables and other abnormalities. Funding was secured and approved for a second drug inspector position to strengthen oversight in healthcare. The Environmental Health Department, 8 environmental health officers were added. So you can see clearly, Mr. Speaker, that we are not only focusing on the infrastructure around the country, but we are increasing the human resources for health. We've also started our school health desk initiative, Mr. Speaker. A pilot is going on, and hopefully all schools will be tied into the school health desk, where all schools will have certain screenings and so on done and entered into the health information system. Our dental program, Mr. Speaker, teaching good oral behaviors for a Healthy Start program in schools. All preschools were contacted, the staff. This initiative also facilitated the production of a children's book entitled Sarah's Visit to the Dentist. It was launched on March 20th to observe World Oral Day. I want to thank Ms. Christabel Christoph, a former dental assistant, who caused this book to be produced, the author, Mr. Speaker. I want us to give a round of applause for her contribution, Mr. Speaker. And the dental unit continues to go to the elder care homes. They were just at Comfort Bay, really doing work to advance dental care in St. Lucia. Very soon, you will see a bus, a mobile dental care unit in St. Lucia. They are working on it. So very soon, they will have this other opportunity. You know, Mr. Speaker, that NCDs play a major role. And our department have been working on the HARTS technical package. 20 primary care facilities were engaged, right now 34 across the island. And you know, Mr. Speaker, that non-communicable disease is a major problem. We also caused the NCD Commission to be convened. Mr. Speaker, the St. Lucia Moves program, Dr. Sierra and her team are in every nook and cranny of St. Lucia, encouraging the organizations to do health walks. And we see in the business places, the schools and other organizations, we see the community taking up the business of health. And you see it all around St. Lucia. I said that before in this house. They are not waiting for the Ministry of Health anymore. They are doing it themselves, recognizing that good health The investment in good health is really, we have to invest in ourselves, the preventative measures. And these preventative measures, Mr. Speaker, are free and low cost. Waking up, walking, breathing in fresh air, staying away from environments that are polluted, trying your very best to keep your communities clean. The hurricane season is coming. Community cleanups. Don't wait for the government to do it. Mosquito breeding areas. You walk, exercise, watch what you eat what you grow. All of these, Mr. Speaker, are measures that we can invest in ourselves, Mr. Speaker. Go to the doctor regularly. Invest in it. Some people tell you, oh, Marlon Health Center, Menpo SP, whatever. And if you want to go to your private doctor, go to your private doctor regularly. Do your tests every 6 months, every 8 months, whatever it is. These are the measures that will prevent you from spending hundreds of thousands of dollars or thousands of dollars in the future. Let us have a culture of prevention, preventative measures, Mr. Speaker. And that is what the St. Lucia Moves program is all about. I saw just recently some young people, spoken word. There's this spoken word program where they are using the spoken word to encourage people to live healthier lifestyles. And all of that is very good. That is the only way we will curb the congestion at our hospitals, the violence, that we should have more, conflict resolution training and play some more. The play days we are having in the different communities with children. Do not take these for granted. Not enough children and people are playing together in this day and age. Everybody's on their phone. So all communities where you see you have community activities, whether it is cricket or play days or family days, we need to encourage more of that because nous c'est moun, nous pas items. We must interact with each other. And that is where children learn how to resolve conflicts. When they are playing their marbles or the games on their phones together, they can resolve conflicts. So all of that, Mr. Speaker, with mental health and so on, we are trying to promote. The Taiwanese mission, I really want to thank the government, the people of Taiwan, who are helping us with our NCD projects. The project is about capacity building. A number of our professionals have gone to Taiwan. This is the third batch for 6-week training, doctors, health aides, nurses, and so on. And we are looking at a multidisciplinary approach to managing hypertension, diabetes, and chronic kidney disease, and so on. The outreach, I've told you, many outreach programs are happening. And together with our professionals, we have developed an app, Mr. Speaker, the iScreen app. So the Ministry of Health professionals and the Taiwanese professionals have developed an app. What it does, when the professionals, the nurses and so on, go to your homes and so on, instead of writing everything on a book, there is an app. We have developed an app where they put the information in, it goes into the system and we can manipulate it, we can gather data from it. So again, it's not just administering medications. We are developing a system where we are creating knowledge, a knowledge-based health system. We are creating knowledge. We have developed an app. And I really want to thank them and I want to encourage the young people to continue in that way. The Optronics organization, the PM attended the activity and gave them some support. And there are other young people with organizations that can develop apps. So if you can develop apps for health, there are some. I've seen 1 or 2 during COVID especially, young people developing apps to help us with diabetes and hypertension. You never know. Come to us and you never know the partnerships that we can develop to help our people realize that NCDs is a big problem in St. Lucia and we need to do something about it. The enhancement of drug monitoring and prevention efforts, the National Early Warning System, we participated in this by the Inter-American Drug Abuse Control Commission, and I'm very happy about that. The Elderly Affairs Department is taking shape. We have our director, we have an officer, we're getting another officer. We are having final consultations on the policy. And I wish to thank the Prime Minister for always taking care of our seniors, always taking care of our elderly. You notice the Prime Minister expanded the program for elder care, and the people of Vieux-Fort North, the elder care workers will know that. C'est gens qui pour casser Gomouna, Premier ministre a mis plus l'argent là Et nous avons plus de monde qui travaille là, et nous travaillons à le week-end aussi, avec ça, c'est un bagage nous avons gardé pour.
Member, you have 5 minutes left. Leader of Government Business.
Yeah, Mr. Speaker, I wish to move that Standing Order 42.8 be suspended to allow the honourable member an extra 15 minutes to complete his presentation.
Honourable members, the question is that Standing Order 32.8 be suspended and Standing Order 32.10 invoked to allow the member an additional 15 minutes in which to conclude his presentation. And now for the question, as many as have the opinion say aye. Aye. As many as have a contrary opinion say no. I think the ayes have it. The ayes have it. Please proceed, member.
Thank you very much. Thank you very much, honourable members. And so, Mr. Speaker, we continue to focus on our elderly. We continue to focus on our elderly. We implemented the 80+ program, and the 80+ program continues to evolve. We are getting data from the hospitals to ensure that we can cause the 80+ program to evolve and take complete root in the hospitals. And as soon as all of this data is collated and so on, we will make an additional announcement in that regard. We see the pensioners again getting some support with $600 in November, Mr. Speaker, and the Prime Minister has indicated that the elders, the pensioners, their pensions will be tied to cost of living and so on. So, Mr. Speaker, we have a government, the government cares about children, babies. The government cares about you in the womb, maternal and child care. The government cares about you, adolescents. You see our programs in the school help desk. You see our programs for early detection of cancer. Cancer, qui est un bagay qui ka toi cassé nous en chai. Cancer à tété, breast cancer. We have gone one step and spent over $400,000 to purchase mammography machines. Ça c'est une machine qui a détecté cancer à tété, madame, bonnet, comme ça, ça joue un traitement. Nous savons cancer à tété a tué chaque madame en cette lycée. Avec le gouvernement, ça là, mettez une machine en Saint-Jude, en sud pays, et une machine en nord pays, en OKEU. Ça c'est un gouvernement, nous pas ça faire toute bagaille one time, mais ça ça c'est un gouvernement qui petit et pas en pas qui mette bagaille en place by santé pays. So, Mr. Speaker, we continue to cause work to be done for in environmental health. And this is a very important department, Mr. Speaker, because when we speak about healthy living and well-being, this department is tasked with so many responsibilities. The port health at our ports, so many ships, a total of 2,918 vessels, for example, and aircraft underwent full risk assessment. Many people don't know that, but the Department of Environmental Health must ensure that the risks are assessed. If people are coming on, whether it be cruise ships or airplanes, the places they are coming from, are there communicable diseases, are there epidemics, so they can guide us. The Department of Environmental Health, many people think of them as people who control vector, like mosquitoes and rats and so on. But it's much more than that. And every time I speak about mosquitoes and rats and so on, people speak about, oh, there's no fogging, where's the fogging and so on. But I always say to them, you are the first line of defense. If every single individual cleans around their home, the whole community is clean. Just think about it. If you have a drain, the drain that's passing right in front of your home, just get up in the morning and clean your section. The next neighbor, clean your section, and clean your section. The whole community will be clean. When I grew up, we used to have football on a Sunday. We cook a macabu, we get a crayfish or something, and we clean in the whole area. That was part of how we grew up. The government has a role, of course. Once a year, twice a year, you do a big cleanup. But it is the community. Say, nous, my going to morde. Lani comme vieta ya bokayo e kadi oh gouvernement ka vintier. Gouvernement my going ka morde gouvernement. It is you, the mosquitoes and the rats and so on. You have old tins by your home. You have all kinds of nonsense. Old vehicles, derelict vehicles. And I know the Minister for Education and Sustainable Development, they are working to get rid of this. But we have, as a country, not only to raise the consciousness of people, but our own lives are at stake. So when the Environmental Health Department, when their officers are going around and some people are giving them pressure, say man, you know, what we don't realize, you are affecting the next person, you are affecting the community, you have receptacles at your home, mosquito breeding, then we have dengue, we have epidemic, and then that connects to the hospitals, it connects to healthcare. We have to put more resources into healthcare. Dengue, hemorrhagic fever, you can actually die. You can die as a result of this thing. So when the mosquito is not just a simple thing. So the Environmental Health Department continues to have awareness drives, and I want to thank Ms. Cheryl and her team for the work that they've done all around St. Lucia. We appreciate you, and we appreciate your work. We know that you are working very hard, and we know that you live right here in St. Lucia. You can't run to any country, so we have to work to ensure that our environment is clean. Mr. Speaker, I want to say to you that over the period, the Ministry of Health, Wellness and Elderly Affairs and the Prime Minister, we've been working very hard with the hospitals. Our hospitals have been under strain for a very long time. Our hospitals have been underfunded, Mr. Speaker, for a very long time. And what we are trying to do, what this Prime Minister is trying to do, is not only to resource the hospital with increased funding, and I've given you an example of how, two examples of how this Prime Minister has increased the funding, both for the OKU Millennium Heights Medical Complex and the St. Jude Hospital. But funding by itself, just funding by itself will not solve the problem. We need proper management, we need proper systems, we need proper accountability, and we need people to do their work. At the St. Jude Hospital, Mr. Speaker, over the last year, again, we see an increase in bed occupancy. A number of people, because of various reasons, but especially because of non-communicable diseases, shaimon, high blood pressure, pisa du, se malade sala, stroke, ek di forba ekosa, shaimon ka tobe malade avec se malade sala, avec St. Jude. We know that the bed capacity is a problem, but during the year, the government assisted St. Jude, Mr. Speaker, to increase the bed capacity. That was done. An additional 8 beds for surgical, 8 beds on the East Wing, and 8 beds for elective surgeries. Mr. Speaker, it was supported by the procurement of 20 additional hospital beds. Mr. Speaker, we spoke about mammography at St. Jude Hospital. The training is being done. And St. Jude Hospital, to improve service, also implemented teleradiology to achieve 24-hour turnaround rate for radiology reports. That is very important, Mr. Speaker. They expanded endoscopy services through provision of a special room. Patient feedback, they are gathering even more patient feedback, Mr. Speaker. They have developed the commissioning team, and we are hoping that the commissioning team, not hoping, but the commissioning team is working with the government and the ministry to ensure that we have proper commissioning of the St. Jude Hospital. Mr. Speaker, we had some capital works to the radiology unit, the dental unit, the medical ward, pediatric ward, the operating room, and so on, Mr. Speaker. The hospital constructed a day surgery waiting area for patients and families to feel much better while they await procedures on their relatives. There are still a number of challenges, Mr. Speaker. The gap for nurses at both hospitals, but the St. Jude Hospital continues to hold its own despite all the challenges. The Millennium Heights Medical Complex, Mr. Speaker, I want to thank the new board under the new chairman, Mr. Speaker. I want to thank them, and I want to thank the new management, and to say to them, the government will support them in all of their endeavors. Capital works, Mr. Speaker. $5 million for the secondary care facility. The hospital had to repair the chilled water insulation system. The hospital had to rehabilitate a ward at the National Mental Wellness Center. The hospital had to upgrade the sewage treatment plant. The hospital had to install a backup generator. The hospital had to upgrade the building management system, repair and upgrade the fire alarm system, upgrade the cold water system at the National Mental Wellness Center. The hospital also had to refurbish the pediatric ward at the OKEU, repair and upgrade the medical gas pipeline at the OKEU, mold remediation, Mr. Speaker. So this hospital, the various boards of management, they have been working very hard, Mr. Speaker, with management to cure these problems, and all of these issues that I've spoken about are being worked on as we speak, Mr. Speaker. It says to you, Mr. Speaker, that the management and staff of the OKEU are not just sitting there on their hands. They are not just sitting, and many of these problems were problems that were inherited, Mr. Speaker. Many of these problems require diligent, systematic work. This is a hospital. And so when the opposition shouts out about OKU this and OKU that, I want to ask them between 2020, when they had to forcibly move the hospital, and before 2020, what did they do to ensure that the hospital was properly transitioned? What did they do, Mr. Speaker? Yes, equipment gone. They spent $25 million in a consultancy, and all of these systems had to be fixed, Mr. Speaker. Yo pas ranger ces problèmes-là qui étaient à l'hôpital là. Yo bay 25 millions pour un consultancy. Avec, yo quitté l'hôpital là comme dette. Et qu'à présent, yo les plateformes qui parlé, Moussa this, Moussa that. Ça va échapper yo, Mr. Speaker. Ça va échapper yo. We have accepted, Mr. Speaker, that the problems that are in health, we are going to soldier on and fix those problems one by one, Mr. Speaker. We have taken on the responsibility of not hiding and running like they did, Mr. Speaker. And take them, and I've showed you in my presentation. Except pas tout temps, Mr. Speaker, many don't want to live là. C'est moi qui buy. There are things that we have done, Mr. Speaker, and before the time, we are going to explain to the people of St. Lucia what we had to do to fix problems, and we continue to fix problems. For we are not there complaining and saying that we don't trust our doctors and our nurses, and that one will go in the annals of history. That one will follow them like their shirt, their coats, their tail coats. It will follow them, Mr. Speaker. What we are doing is we are working with the professionals to ensure that we increase services and we improve the conditions. Not only in the infrastructure, but the Millennium Heights Medical Complex. They continue to strengthen systems, the accreditation system, both that hospital and St. Jude. They are working on accreditation, Mr. Speaker. They are working with Accreditation Canada. They are building systems which will bring in the Tapion Hospital, Mr. Speaker. And they are working with the management of Tapion Hospital to formalize informal relationships that have existed for a long time. And I've said before, doctors and nurses always collaborate in the health system. But we want there to be one health system where one can lean on the other's expertise and everybody can benefit. The supply chain management issues, they have moved to improve the service and delivery across the Millennium Heights Medical Complex. They have expanded clinical services, Mr. Speaker. At Millennium Heights Medical Complex, they have strengthened mental health services. The strategic and administrative developments, Mr. Speaker, they are working on an institutional strategic plan, which will have a new mission and vision and structured operations. I spoke about mammography services. There is a year of engagement where they will engage the community, the staff, and everybody to continue to improve the hospital. And I've spoken about the infrastructure, Mr. Speaker. I tell you, we are going to engage all doctors, all nurses, anyone, Mr. Speaker, who wants to put their hands, their minds, and their soul in the improvement of the healthcare sector in St. Lucia. And we continue to engage them. We have contracts with private organizations, with labs, to provide services. We have engaged new services with our doctors, internists, Mr. Speaker, and I'm having glowing reviews of those new services, Mr. Speaker. Internists at Soufrière, at Vieux-Fort, okay, gynecology services, we have expanded all of those. So we are on record, Mr. Speaker, and the evidence is there to show that we have moved in a positive direction when it comes to healthcare reform in St. Lucia, Mr. Speaker. And while we look at OKEU, we recall the Prime Minister making the bold statement and taking the decision that we are going to build the fifth wing of the OKEU hospital, Mr. Speaker. Fifth finger, Mr. Speaker. Again, that's going to be a glorious
Member,
day
you have 5
when we
minutes left.
begin. Thank you, Mr. Speaker. And the St. Jude Hospital, Mr. Speaker, that by itself is not just going to be an opening. It's going to be not just a carnival, not only a fashion statement. It's going to be a bold statement of confidence in the government led by the Member of Parliament for Castries East. Mr. Speaker, all of the support to St. Jude and the OKEU didn't stop just there. In the budget, the playing fields in Vieux-Fort North will get support. The Bellevue playing field, we were delayed. We were delayed, Mr. Speaker, but now we have completed the main drains. We are now going to do the resurfacing. Mr. Dwayne Edward will be engaged to ensure. Then we are going to build a washroom, and we are going, hopefully in the next few months, the people of Vieux-Fort North and Bellevue can have a grand opening ceremony for that. The Piero playing field, Mr. Speaker, I'm not going to say anything, like I always tell my people in Vieux-Fort North, say, lemo tractor ek lemo ba ina pale. Na chen si gwe mwen toujou. So the Minister for Sports will talk about the Piero playing field. I know what's happening. I have seen things, but I'm not saying anything. The roads, Mr. Speaker, I thank the Prime Minister. We have started work on the Zabo to Bellevue playing road. Last year, we said that in the Parliament, and I can report this year that significant progress has been made. We are starting the Grace Woodlands Road. Just the cleaning that has been done, Mr. Speaker. The people of Grace, I know you are anxious, but it's just the cleaning works we are doing, and the full works are coming right after it. The Prime Minister did announce Canels Kako Vige to Piero Road. It's a major road, Mr. Speaker. You know, it's a difficult road, and we are going to deal with it. I'm very happy for the land proposals. There are people from Vevasel, Larry Tuet, Opicon, Grace, Bellevue, where they are on Crown lands, Mr. Speaker. And they have not only been there for 30 years, they've been there for 40, 50, 100 years in some cases. And I'm very happy that some of these people, Jashos and the people at Vevasel from Palmis, all of these people at Vevasel who have asked me the questions, you too are part of this development, Opicon. But the one thing I want to say, Mr. Speaker, people who have been there for 30 years, pas kuma say, blow, kuma say, may chop like wood because we are not encouraging squatting. I have said so in this house before, and I'll say it again. A lot of the people who have built houses on top of the Piero Hill, ça parte gouvernement. Ça c'était NIC. Bon, NIC qui est venu pour pointer. I only hope, and I've said so in Parliament, I'm not afraid to say it. I only hope the people who have occupied lands at the top of the Piero Opicon Hill, les mettre à Kaivin point, pas dire moi c'est un vieux politicien. We support you. If you have been occupying the lands for a long time, there is Proud. Proud has a subdivision now. Proud Kaivini, you can vante by Munki Patini Pieste. They will have a lower fee for people who have been living there long. Mais pas just I may kaila because you turn gouvernement On est pour la pour 30 l'année, 30 years. Et qu'on a joué un papier. So pas di ma aimé, nous just vle bagay fait. Bon, nous pas vle pièce, là nous regarder view Fort North in the next 10 years, vous comme vieux bagay par là, la pa ni sou par là, la pa ni chimé par là. Non, 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 non. Nous vle bagay nous fait propre. So, all those of you who live at Veversel, those of you who live at Lautouet, Hope Estate, en Guas, ou ka wete le gouvernement pour 30 l'année, moi ça c'est Willy, là ni tellement moun me connaître. Ça fait ou kay manger. Ça fait ou kay manger. Mr. Speaker, I just wish once again to thank the Prime Minister and thank cabinet colleagues who have stood by me and the government and the people of St. Lucia with healthcare reform. Everything is not perfect, Mr. Speaker. There are many areas where we still have gaps. But in 3.5 years, Mr. Speaker, you can see what we have done. And you can go back to see what they said they would have done. And the difference is very clear. The Member of Parliament for Castries East has demonstrated that he cares about the people of St. Lucia. He promised and he has delivered, Mr. Speaker. I am sure the people of Vieux-Fort North and the people of St. Lucia will return this man, the Member of Parliament for Castries East and Prime Minister, to the Prime Ministership of this country whenever elections are called. I thank you, Mr. Speaker.